Thank you. My name is Max. I'm a freshman at the college, and I want to ask a question that's a little bit about the other side of the equation, which is how you pay for all the things that you've been talking about. You've talked especially a lot about education, about investing more in college, about establishing universal pre-K. But with the exception of Ms. Khayyam mentioning reductions in prison spending, I don't think anyone has mentioned a way to either increase taxes or to cut other costs to pay for that. So I'm wondering what specific provisions would each of you introduce, whether to raise revenue or to cut costs, in order to pay for the various plans that you're proposing?
We'll start with Mr. Grossman.
I think I talked about it earlier, but I think really if you have a series of initiatives that you'd like to invest in, a series of investments, and I think we could all agree that there are probably 8 or 10 things that we would like to invest in, and we could come to consensus on those things that we'd like to invest in. They're going to cost a lot of money. Now, obviously, we've got to find a way to reduce healthcare costs in Massachusetts. We passed Chapter 224 to reduce healthcare costs. We've got to reduce our healthcare costs, using community centers, moving patients out of acute care hospitals into community centers, into community medical facilities, wellness programs that can save money. So our healthcare system is crowding out almost everything else that we've tried to invest in. Over 40% of our state budget is in the healthcare expenditures, and if we don't reduce our healthcare expenditures, none of this is going to be possible. But let's assume that doesn't happen in the short term. So the real question is, where do you find the money to pay for it all? There's only 4 ways to do it. 1, you can grow the economy dynamically and use that growth and the growth of revenues. 2, you can save money. I have a track record of doing that. I've saved tens of millions of dollars as state treasurer. We're on our way to saving $100 million at the state pension fund alone. That probably won't do it enough. Public-private partnerships will do some of it. So I think the real question is, are the people of Massachusetts, with a governor who's willing to be an advocate, and I'm willing to go to every one of the 40 Senate districts in the state and lead a public conversation, lead regional town meetings and say, these are the things we need to invest in, and if we can't find the money from those other sources, are you willing to make investments to improve the quality of life for every one of our citizens? Higher education, universal pre-K, mental health, behavioral health, substance abuse. Those are all things that we need to invest in. And a governor who's willing to lead that conversation and who is fearless about leading that conversation and who's willing to take the consequences of that discussion, that's the kind of governor I hope you want in your next governor. I'd like to be that governor.
It's a big question, so there's a couple answers. So obviously, I would shift priorities, because budgets, anyone who's been day one, I was with this governor, close to day one with this president, a budget is a reflection of our values. And so I see numbers, and numbers are really, do I care or do I don't care? You can throw out any great idea, especially as a candidate, and say, I love this, and unless you can actually get it done, it means nothing. So when I talk about criminal justice as being a reform we absolutely need, it is not simply because I think there's better policies, but actually there's better policies that are cheaper. So that you can move it. So that's sort of the first step, is can you move around sort of your basic pools of money? Second, as the treasurer said, how can you generate growth and economic growth? And there's a number of ways I've proposed. For one, and people hear me say this all the time, I've been to 44 other states. I've been to over 50 other countries. It is actually relevant for a governor's race, because we are in competition for a global economy. So what can I do as a governor to attract those businesses that will come here and stay here and hire Massachusetts citizens, right? So it might be tax breaks, but I'll tell you what it is. It is workforce development, because that's the backbone of any economy, and it's infrastructure. So those investments will come in the short term, right? But long term, they will generate revenue. And then, like as the treasurer said, I don't like it when Republicans make no tax pledges. I don't like it when Democrats make no tax pledges. We have to have a conversation. Taxes are a way to generate revenue in hard times. It's the same discussion with casinos. And so day one, look at, can we generate fast enough for our investments? But if we don't do that, if we don't do those 3 things, we will fall behind, and we will not create a society that is that is prepared for the future, whether it's climate change, whether it's economic downturn, whatever it may be. That's our goal.
I'm so glad you asked the question. I am going to be the governor that controls our healthcare costs, as some of the other speakers talked about. let's just talk about the dimensions of it. It is 40% of the state budget. It's up from 20% just 12 years ago, and it'll be 50% by 2020. That is crowding out virtually everything that we've talked about on this stage. So we have to control healthcare costs, and the good news is we absolutely can control healthcare costs. We have a wildly inefficient system. I've been in the system as not only as a surgeon, but as a manager, and so has Don. We know how inefficient the system is. If, in fact, we can bend the medical trend, we can curb healthcare costs, which we know we can by bringing efficiencies to our system, and it's 39%, that's $350 million a year. That's $1 billion over 3 years that can go to some of these investments. So this is not, gee, I hope we can control healthcare costs. We have to control healthcare costs, and we absolutely can. Our own Health Policy Commission, which was formed from the law that Steve was referring to, Chapter 224, did our first study in which we can look across all the people who are covered now, because everyone is covered, and understand our true costs. Their own report came out a couple months ago and says that we have about $29 billion in waste. That is healthcare that we're spending without getting improved outcomes. That's $29 billion. Now, that's not just in the state government. That's across all expenditures. But that shows you the magnitude of inefficiency that we have in our system. And by moving towards more organized systems of care, using having doctors operate in teams, and moving away from fee-for-service payment systems which reward quantity, not quality, we can not only have a better healthcare system, we can have it much more affordable. And for the state government, that creates a lot of room to invest in things. I might also say it's the biggest budget buster in our cities and towns. So our municipal governments, we have to control healthcare costs. We can do it. We can do these things without raising taxes by doing that, and that's what I would do as governor.
Well, Max, thanks. I understand financial discipline. I started a small organization, grew it to global scale. We never laid a worker off and thrived as an organization. I know what it's like to run a successful organization and can do it at the public sector as well. We have to find the money, though. There are 3 sources of money that I can think of that are big. The first is healthcare expenditures, as Joe has said. It's 42% of the state budget. We now have 3 independent reports saying that 34%, 30%, 38% of our healthcare expenditures are pure waste. We need to get to work on that. One of the reasons I favor single-payer care is I think it's a way to get some of the administrative costs out right away. That will take a governor who understands what the new healthcare system really needs to look like and has the courage and the confidence to progress our system toward that, and billions will be saved. It's $14 billion in our state budget. If we could save 10% of that over the next few years, that would be $1 billion a year to put into our roads and our schools. The second are tax loopholes and exemptions, something I've been looking at quite closely now, and you'll soon hear more reports on that from our legislature. They are massive. They've gotten there through special interests in many political environments through the years. It's time to reset them to 0. Tax loopholes that add jobs, I would love to keep and add. Tax loopholes that support the safety net, I'm in favor of. The others are zeroed out, and there's billions there. Finally, is we do have to change our approach to taxation. It needs to be fair in this Commonwealth. We need to have a regime in this Commonwealth in which people at low end of the income spectrum pay lower rates, and people at the higher end pay higher rates. We've got to move there. As governor, I will try to move our Commonwealth into that fair tax approach, and we will need resources to invest. That will come back in the savings that will come when we're not kicking the can down the road on all these important problems.
So I have, for the last 16 years, had to look at a budget first as DA and hiring folks and looking at what money we have in the last 8 years, not only looking at how I run my own Attorney General's office, but what I can do for the Commonwealth. And one of the things that I know every day, taxpayers pay my salary. I am conscious that we have the obligation as an Attorney General, as a Treasurer, as a Governor, to make sure that we make the decisions that are going to be cost effective. I think we waste a lot of money in this state. I see it. And so you start there. Whoever becomes governor comes in halfway through, starts a budget in January, and I think you need to do a top-down look at what we spend money on, what we accomplish, what we need to invest in terms of technology, get some bond bills, invest in things that will make us more cost effective, and figure out, as Juliet said, where are those investments that you need to make money. I do believe as the economy turns around, we will have additional revenues. But I've spent time, for every dollar I got in my budget, we brought back 10, because we've cut back on waste, fraud, and abuse. We bring back hundreds of $millions in Medicaid fraud. We brought back money from Wall Street, both to individuals and to the states for the predatory lending. I'm very, very conscious of trying to make every dollar make sense. And I think you have to look at what we spend now, where we can get efficiencies, where we have to invest. And I think none of us on this stage really know what that's going to cost or where we're going to have to go for or what that budget's going to be. But those are the first things you need to do. What do your revenues look like? What do you need to invest in to save money with what you do? How do you cut waste, fraud, and abuse? And then figure out realistically, what is your real budget that you can work with, and how do you do it so it's cost effective for the taxpayers of Massachusetts? I don't believe those are mutually exclusive. I think government can be good and cost effective if we have the right management in the governor's office.